Last time we see the internal carotid artery introduction. Today we are going to study the first part of the internal carotid artery, which is cervical part. Internal carotid artery has four parts. First one is cervical part. Start in the neck. Now let's talk about the first part, cervical part. Cervical part starts its journey in the neck region, goes straight up from the common carotid artery and reach the base of the skull. Internal carotid artery walk up in the neck wearing the carotid sheet. What is inside this carotid sheet? You know that laterally there is internal jugular vein, and posterior to internal jugular vein and internal carotid artery there is vagus nerve. At the beginning of the internal carotid artery there is a dilation. This dilation is called carotid sinus. What is the function of this carotid sinus? It acts as a baroreceptor. It is a blood pressure sensor. Check if your blood pressure is too high or too low, and it sends its signal to the glossopharyngeal nerve. So you must remember one of the relationship of internal carotid artery is going to be glossopharyngeal nerve. Let's study the posterior relationship first. There are four nerves that we are going to study. First one is glossopharyngeal nerve. As you studied recently that the carotid sinus sent its signal to the brain with the help of glossopharyngeal nerve. So glossopharyngeal nerve is present in the posterior relationship of internal carotid artery. Second nerve you see is the accessory nerve. It is the 11th cranial nerve. We know that accessory nerve supply trapezius and sternocleidomastoid, and these are the muscle of the neck. So accessory nerve is also present in the posterior relationship of internal carotid artery. The next nerve is hypoglossal nerve. It controls the tongue movement. It is the 12th cranial nerve. As you can see, this is the carotid sheet. This is the anterior side, and anteriorly there is ansa cervicalis. Ansa cervicalis is loop of nerves and it innervates the infrahyoid muscles. Posterior in the carotid sheet there is sympathetic trunk. Sympathetic trunk help in fight or flight conditions. Vagus nerve, as you already studied, also run in the carotid sheet posterior to internal jugular vein and internal carotid artery. Internal jugular vein. The first structure we find lateral to internal carotid artery is internal jugular vein. Second structure lateral to internal carotid artery is temporomandibular joint. Now we are going to see the structures that are present toward the medial side. Toward the medial of the internal carotid artery, there is pharynx, and the second structure we see is a little bit anterior medially, and we have already studied this structure into the anterior relations of the internal carotid artery. So the second structure is external carotid artery.
Structures in relation to the internal carotid artery anteriorly. Within the carotid triangle, to anterior is sternocleidomastoid covering the triangle laterally. Anteromedial external carotid artery branches out here. Posterior belly of the gastric forms the superior boundary. Parotid gland partially overlaps the region. Styloid process bony landmark. Muscles attached to styloid process. Stylohyoid. Stylopharynges.